Hi, and welcome to the webinar for the new PHEHP Mentorship Program. So basically, this is going to be a year-long program that's really designed to help everyone who wants to be a mentor develop the skills and the tools that they need to become effective mentors. So basically, I'm going to go over in this presentation a little bit about kind of what the program entails, what the timeline is, what the expectations are, and kind of what you're going to get out of it if you're part of it. So just to start off and introduce myself, my name is Marissa Brash, and I am the mentorship chair for the PHEHP section of APHA. So this program really was born out of the fact that APHA does have its own mentorship match. But one of the things that we noticed is that there were a lot more mentees than there were mentors available. And a big part of where that came from is a lot of people saying, I really just don't feel confident that I have the skills or experience to be a mentor. I don't know how to be a mentor. There's not a lot of guidance or structure provided. So while APHA is doing a great job of matching people, one of the things that we discovered in this PHEHP section is that we are made up of a lot of health educators, kind of by definition, public health education, health profession. So we have a lot of health educators. And one of the things that we have to provide is an opportunity to really explore a framework that sets us up for success in how to be a mentor. So the goal for this program really is to provide mentors with the skills and the resources for how to create an effective mentorship relationship. So part of our program does still involve a matching aspect to it, but really the essence of it is kind of this train the trainer type model where the goal is really to educate people who want to be mentors in some of the topics, some of the expectations, and some of the resources that are going to help structure an effective mentor relationship. So basically, just kind of an overview of what this program entails is it's launching today. So October 2nd, 2024. This is our webinar where really we're going over what this program entails. And then from here on out, part of what will be going on is monthly webinars. So the monthly webinars are going to be held on the first Thursday of every month. They will be 4 p.m. Pacific Standard Time, I'm in California, or 7 p.m. Eastern or 6 p.m. Central, depending on what your time zone is. So they are designed to be in the evening, hopefully a better time of day for people who are working. But basically, the idea here is there'll be a session, like a formal structured session every month. And the goal of the session is going to be really to educate mentors on the really key components of a mentorship. And so that then you have the self-efficacy to actually be able to apply these skills in one-on-one sessions with mentees. So really, the goal here is to provide enough structure, rigor, and resources to give mentors the skills and confidence to be successful. So the goal is really just to guide mentors. So even if you're not signing up to be a mentor with a mentee in this program, if you already have a mentee, if you're interested in potentially being a mentor in the future, there are a lot of topics that are going to be discussed, as well as resources provided each month that will still benefit you in any mentor-mentee relationship. So what we really want to do is provide a program that's beneficial to both mentors and mentees. So there is a matching component of this where there will be opportunities for mentors to not only receive the guidance through the webinars, but there's also really opportunities for networking with other mentors, having this peer-to-peer connection, developing leadership skills, and really also expanding their own communication skills and developing a stronger professional network. And then the mentees will then have access to these mentors who have structured experience, who have actual resources, who have topical preparation in terms of how to guide any sort of public health practice and how to navigate their careers. So really the mentees will have access to all of this information that the mentors are getting in real time. So the way that our webinars are structured is that in most of the sessions, and I'll go through each month in specific detail. So hopefully that provides a little bit more of a guiding expectation of what the sessions are going to cover. But basically most of the sessions are going to be broken up into this specific structure where they'll be an hour long. So again, they'll be on that first Thursday of every month from 4 to 5 p.m. Pacific, 7 to 8 p.m. Eastern. And basically there'll be a facilitator who's going to be an expert in the field, who's going to come and provide like a 20-minute basic discussion lesson. They're going to provide resources, framework, handouts, basically providing best practices and anything that you need to know in terms of being aware of this particular topic. Then there'll be 2 breakout rooms where the mentors will have a chance to talk to each other. So 2 10-minute breakout rooms that allow for the opportunity to have small group discussions and actually then practice some of the skills that are being discussed. So we practice on each other as mentors before we're actually meeting with our mentees. Then the last kind of half of that session, we're going to have an opportunity to talk about situational topics. One of the things we know is that our public health landscape is constantly changing, whether it's due to social or cultural factors, or it's due to political changes, or it's just due to geography or other types of things that are happening, natural disasters, etc. Public health is changing all around us. And so as a result, sometimes there's going to be the policies that are changing. There's going to be things in the news that are important to talk about. And these are things that are going to impact us in our public health workplace. And so in each webinar, there's actually going to be time set aside for situational topics, meaning anything that's impacting the field of public health that's going to be beneficial to our ability to either navigate our workplace, navigate the kinds of programs and community opportunities that we're providing, or really just how we're going to engage with other members of our community. And so there's going to be an opportunity to actually talk about current events or any really important pressing things that are currently changing in public health. And so that will give us an opportunity as mentors and peers to discuss it. And then it'll also give us an opportunity to discuss how we would talk to any of our mentees about this potential topic as well. And then last 5 minutes will be just reflection and any sort of wrap up to reflect on that content and prepare for whatever's going to come up in that next meeting. So that's kind of the structure of each of the webinars, and each webinar each month will have a different topic. So now what I want to do is actually go through an overview, a brief overview of what topic we are going to cover in each month, because this lets you know if this is something that's going to be beneficial to you, if it's going to provide information that's going to really benefit you either in your own professional context or benefiting how you would potentially engage with a mentee. So October, that's now. This is the launch of the program. So today is our official webinar where ultimately I'm trying to introduce the goals and the structure of the mentorship program. At the end, I'll also provide you with the link to the application for both mentors and mentees. Then also we're planning to have an in-person meetup at the APHA annual meeting in October. So this will give us a great opportunity to have some face-to-face networking among any of the people who are either mentors or mentees. So in the PHEHP business meeting 2, our plan is to have an opportunity to have that networking. So the PHEHP business meeting 2 is on Monday, October 27th, I think. It's the Monday of the PHEHP or APHA meeting, and business meeting 2 for PHEHP is 7 to 8 a.m. It's a little early, but the benefit is that we also have breakfast provided. So we'll have coffee, we'll have tea, we'll have breakfast, and we'll have a nice opportunity to get to know each other in person. So anybody who's coming to APHA, whether you're a mentor or a mentee, or if you're someone who's interested in getting involved and you want to know more and you want to ask about it, great opportunity to come talk to us in person. Then we'll also have, like I said, an opportunity to sign up and be a part of this program. So that's really getting us through October. And then our first actual webinar is going to be in November. And the topic of November is going to be understanding the different types of roles that occur in mentorship relationships. So our goal is to discuss the distinct, roles and responsibilities of both the mentors and the mentees. This is really important because in order to have productive relationships, we really want to clarify, boundaries and expectations. And we know that, in our public health practice, collaboration is so key to success. So we really want to better be able to, navigate professional relationships, personal relationships, community relationships, and really recognize the different types of role dynamics that exist. And so part of that's going to also lead to our ability to set realistic goals and to be able to maximize the benefits of mentorship relationships. And then we also really want to talk about how you transition through the different stages of mentorship processes. So how do you initiate a relationship? How do you terminate a relationship? How do you determine when you need a new mentor? How do you determine if you're at a stage in your career, if you're at a stage in your life where you're open to a new mentorship type of relationship? Then in December, we'll talk about building trust, and that's obviously essential to a mentorship relationship. So we really want to talk a little bit about, how as public health professionals, we are able to tackle, sensitive issues like, health disparities and patient care and any sort of health communication. The ability to build trust is essential. So what we'll also talk about in the session is going a little bit deeper into the natural progression of a mentor-mentee relationship so that it leads to, deeper, more meaningful engagements, and really how to encourage and utilize trust effectively. Then in January, we'll go into one of the most important skills in any relationship, which is communication. So in the webinar for January, we'll talk about some of the active listening techniques, and we'll talk about, thoughtful questions. We'll talk a little bit about ways to make sure that, both parties are able to feel heard, understood, and able to express their ideas clearly. So again, in public health, we know that collaboration and stakeholder engagement are so critical. And the best way to encourage that is to identify ways to, utilize effective communication so that we can, create more productive relationships. And so the goal here is to help mentors be able to develop ways to communicate thoughtful guidance, effective feedback, because that can be both positive and negative. It can be critical, it can be constructive criticism. So how do we share some of those things in a way that can potentially be sensitive, right? So let's talk about how to communicate difficult subjects. Then in February, we'll have our first virtual meetup, which is an opportunity that's really kind of more unstructured. So there's not like a formal lesson or a formal expert who's going to come. It's really going to be led by our mentorship team for the PHEHP section. And our goal here is really to just have like an open forum where mentors can kind of share experiences and ask questions and reflect on the progress they've made. So it's really designed to be an informal session that's really set up to allow for like peer support and feedback. And so this is just going to be an opportunity to create our mentor community, because I think sometimes our field can make us feel isolated. And so a network of mentors and peers can really be beneficial for maintaining motivation and personal growth. And we can talk about challenges together that we've had as a mentor. Hey, my mentee brought up something really challenging, or my mentee had a question, or I've had this problem in my professional context and I'm not sure how to navigate it. So I definitely don't know how I would teach a mentee how to navigate it. Could we talk about it and troubleshoot it together as a group? So that's basically the idea behind this, is to have an unstructured session where we can really talk to each other and explore some of these topics in more depth. In March, we'll jump into the idea of cultural competency, which is a critical issue in public health. So basically, we'll talk about how to work with diverse populations. And this March session will help us kind of explore how mentors can help their mentees navigate the different kind of cultural differences, and ultimately to foster inclusive environments. The goal is to understand and appreciate diverse perspectives, so that both mentors and mentees can become even better public health practitioners, and that we have more skills and resources that are going to help us to be able to meet the needs of the various types of communities that we are working with. In April, we'll jump into goal setting and balance. So the idea is to help kind of try to set some realistic and achievable goals. This can be both personal and professional goals. So we can also talk about like how to manage time effectively and how to maintain a healthy work-life balance. We know in public health that our workloads can sometimes be demanding, and burnout is a real risk. And so these skills in terms of time management and strategies for maintaining a healthy work-life balance, these are essential. So we are looking to be able to provide opportunities to have mentors, model and teach time management, and this kind of balance that we can help kind of work through together can help mentees build sustainable careers, but it can also help mentors ourselves as we try to struggle with our own goals for like achieving professional success. So there's benefits again from the mentor perspective for ourselves, talking about our own burnout, talking about our own work-life balance, but then also how do we communicate best practices to our mentees. In May, we'll look at managing workplace conflict. Conflict in the workplace is inevitable, but the goal here is to be able to provide tools for how to manage it effectively. So again, we know in public health, we are expected to be able to collaborate. And that means that we need to be able to navigate conflicts with colleagues, supervisors, or patients, right? So the goal in this session will be to teach mentors how to guide their mentees through difficult situations, and also how to turn conflicts into opportunities for growth and learning, so that both mentors and mentees will be able to focus on learning conflict resolution techniques and different types of communication strategies that will allow, again, both mentors and mentees to handle workplace challenges. One of the benefits of all of these sessions is that they're beneficial to the mentors for themselves, because mentors don't have all the answers. That's why we're doing this webinar, so that we as mentor can practice these skills, but then also we can help to encourage our mentees in terms of how they can also navigate these kinds of challenges. In June, we'll have our second virtual meetup. Again, an opportunity just to reflect on the progress that we've made so far, to talk a little bit about this will be like our opportunity for like a mid-year reflection on the mentorship program as a general focus. And so everybody can talk about progress. We can kind of like reassess goals. We can share feedback. And so we'll use this session really for like the continuous, improvement cycle, so that we can make any changes or develop any additional resources or tips or tools or speakers or whatever seems beneficial to really apply to the second half of the program. Obviously we value flexibility and adaptability in public health. And so I always look for opportunities of reflection and look at this like opportunity for a midpoint, feedback refinement, so that we can, continue to build opportunities for leadership and collaboration. And we can, course correct for the second half of the program if there's anything that feels like we could do more of or better, or a topic that we're not currently covering that's really coming up again in like the situational side of things, like current events. Then in July, we'll move into career progression, and mentors will learn how to help their mentees advance professionally. So we could talk about things like seeking promotions and negotiating salaries and long-term career plans. So really the goal is to talk about, sometimes in public health, jobs aren't always clear cut. We don't always have a distinct job description. Sometimes we have grant funded cycles. So sometimes there's some interesting challenges that we have to advancing our careers. And so, this is a great opportunity to talk about some of those aspects that are really unique to our profession. And so the goal of the session is to equip mentors with the tools to help, again, mentees as well as themselves advocate for themselves and advance their careers in public health. And so, there are some unique challenges in this profession that I think will be beneficial for us to discuss together. Then August will focus on building connections, because networking and relationship building are such essential skills in public health. So we'll talk about how mentors can help their mentees build these, lasting professional connections, and also to identify collaborative opportunities, because we know that these relationships are vital for our career development. And we know that they impact our ability to work with stakeholders in public health. And so we want to help mentors and mentees create strong professional relationships that lead to, opening doors and creating new opportunities, and really being able to support career longevity. Then in September, that'll be the end of our program, because that'll be exactly a whole calendar year. So this will basically conclude our last webinar with an opportunity for, a focus on reflection and evaluation, and we can discuss kind of anything that has led to, professional growth, or how this has led to changing future goals, and an opportunity also to kind of just debrief and evaluate the mentorship program as a whole, and reflect on the different experiences and outcomes we've had working with the mentees. We'll also, discuss the impact of mentorship and set goals for the future. We know that this will be the end of the calendar cycle, and then hopefully, if everything is successful, we'll start a whole new mentorship cycle in October, again, aligning that with that timing of the APHA annual meeting. So the goal is really to create this lasting mentorship program, which will have kind of the same structure and timing every year, with different topics and different speakers, but an opportunity to kind of continue to grow. And so this will be kind of like our debrief session, but also an opportunity to not only end the cycle, but also start the next cycle. So to finish up the first year of the program, and then kind of segue into that second year. So, now that I've kind of gone over the overview of the program is, I just wanted to clearly set up what, like, if you decide to join the mentorship program, kind of what those expectations are. So part of the expectation is participation in monthly webinars. So again, that first Thursday of every month, 4 to 5 p.m. Pacific, 7 to 8 p.m. Eastern. Those are the monthly webinars. So the expectation is that you'll attend most of them. Now, if you can't attend all of them, we will record them and share them. But because there is that structure of 20 minutes of facilitator lesson, and then the breakout rooms, and then all of the situational topics, there really is value to being there synchronously rather than just watching the video later, because you won't have that opportunity to ask questions, to navigate, to practice, to role play the way that you will in the live session. So the goal is to have you attend as many monthly webinars as possible, but obviously if not every month is possible, that's okay too. Then the expectation is that you'll be matched to a mentee. And in our form, we do ask you to choose the number of mentees that you want to work with, anywhere from 1 to 3. Some people prefer one-on-one sessions, but some people prefer more group-based sessions, and that's okay too. But that's why I say one-on-one, but I one-on-one in air quotes. So the idea is that you'll engage in mentorship sessions. But mentors and mentees can set those expectations together during their initial meetings. It's not prescriptive, but on average, I'd say a time commitment that's manageable for business professionals. So most people are going to choose to have virtual interactions, meaning like a Zoom meeting, or you could have a phone call, even text messaging for some people might be more beneficial. But some people might prefer face-to-face meetups, and that's okay too. In that sign-up form, you can choose your preferred preference, and I can help match you based on those preferences and your availability. And then again, you can choose how frequently you want to meet. So some people might say, you know what, let's just schedule meetings as necessary. If something comes up, you can text me, we can call, we can set up a meeting. Someone might say, we're going to meet, once a week or once a month or once a quarter. Again, because we do have the sessions set up to be webinars that, first Thursday of every month, it does make sense that you would then meet with your mentee once a month, because you'd want to utilize what we covered in that. But you might not want to use every single weeks, and that's okay. Every month, they might not be applicable to you. They might be not applicable to your mentee, and that's okay. So you don't have to meet once a month. It's just set up so that you have the resources and self-efficacy to have a topic that you could discuss once a month. But again, set it up based on a time commitment that's manageable for both you and your mentee. And then again, as long as you guys have clear communication and expectations, that's all that matters. And there's no expected frequency of meetings. There's no expected format of meetings. It really comes down to whatever works for both of you. So if you heard all of this and you think, wow, that sounds interesting, I'd like to consider being a mentor. And maybe I didn't sign up to be a mentor in the past because I didn't know what I would share. I don't know if I thought if I had the skills. Well, this is the opportunity to sign up and see if this is a program that helps you not only with the ability to communicate with a mentee, but also your ability to navigate some of these issues yourself in your own professional practice. This is the opportunity to sign up to be part of the program. So today is the day that those registration opens up to be either a mentor and or a mentee. So I have the QR codes on the slide. So the QR code on the left is for mentors. The QR code on the left or on the right is for mentees. So you can scan the QR code. It'll take you to a Google form. And on that Google form, it'll just ask you a few questions about your interest, your background, your experience, your availability, so that we can use that. So the idea is that you can apply now, and then the matching process will occur throughout the month of October. And then by the time that we attend the annual meeting, we will match everybody and pair people based on shared interests and professional goals. And so I plan to let everybody know who their match is basically right before we go to APHA. One of the questions on there also is if you're attending. So again, we'll have that meetup opportunity if you are a mentor or a mentee and you want to get together in person at a designated time and space where we're all kind of in that same area. We actually have a designated time for PHEHP for that meetup as well. I do encourage everyone to join the program either as a mentor or a mentee. So you don't have to be a seasoned professional, thinking that you have years of experience to provide guidance. Sometimes it's a great opportunity to talk about how somebody navigates from just finishing a degree to getting into public health. So even if you're a brand new graduate, if you're brand new to public health, you can still make a meaningful impact in terms of where somebody's at in their professional context. So I really do want to encourage everybody who has ever thought, I would love to be a mentor, but that's really what this program is for. I'd love to be a mentor, but I don't know that I have the skills. I don't know that I have a background. I don't know that I have enough experience. I don't know what I would talk about. I don't think I have enough resources. This is a program that's designed to kind of guide you step by step through that relationship so that you don't have to think about whether or not you have the background. We're going to help train you and teach you. And again, you can use that in the mentor-mentee relationship that you're matched to in this program. But again, you can also use this for your own personal professional context, and you can use it for any mentor relationship in the future as well. So we'll have experts speaking each month. We'll provide resources, readings, handouts, activities, opportunities for role play to really explore these ideas together. So like I said, no matter where you are in your public health career, even if you are currently a grad student, you can mentor other students interested in being a grad student, right? So no matter where you are in your public health practice, if you think you'd like to be a mentor, either now or in the future, I encourage you to sign up for this program and to help develop your skills in public health mentorship. So I have enjoyed having the opportunity to kind of go through this with you. If you do have any questions, please feel free to reach out to me. I am going to end the recording now so that anybody who's in the webinar has the opportunity to ask individual questions, but without their questions being recorded. But if you are somebody who's watching the recording of the webinar, then you can absolutely reach out to me. I'm happy to schedule a meeting to discuss. I'm happy to answer emails, and I really let you know more about expectations, commitment, and if this is a program that's going to be beneficial for where you are at this stage of your career or your education or your goals in public health practice. So please feel free to connect with me. Like I said, I'm going to end the recording now so that I can answer questions for anybody who is currently in the webinar without their questions being recorded. But thank you for attending the presentation, and let's continue in just a minute.